Okay, so let's unpack this. We got some really fascinating sources here, and our mission today is to really dive deep.
Yeah, pull out the key insights on this condition, Takotsubo cardiomyopathy.
Right. Most people probably know it as broken heart syndrome, which sounds, well, almost poetic, doesn't it?
It really does. And it's a bit of a medical puzzle. It shows just how deeply our emotions and our physical health are intertwined, especially our heart health.
It presents just like a heart attack, right?
Mm.
Sudden chest pain, shortness of breath, all the scary stuff.
Exactly. But, and this is the crucial part, it's not caused by the usual suspect blocked arteries.
Okay, so it's like the heart's having this extreme but temporary reaction to intense stress.
That's the idea. So our goal here is to sort of cut through the noise, pull the key facts from these sources, and really get a handle on this pretty unique condition.
Makes sense. Let's jump in. So first off, what is Takotsubo cardiomyopathy fundamentally?
At its core, it's a temporary condition where the heart muscle, specifically the left ventricle, suddenly weakens.
The left ventricle. That's
Huh.
the main pumping chamber.
That's the one. It just loses its power to contract properly for a short time.
And the name Takotsubo, that's quite specific.
It is, yeah. It comes from Japanese. It means octopus trap.
An octopus trap.
Mm.
Why?
Well, picture one of those traditional clay pots they used. Kind of narrow at the neck, but then it bulbs out at the bottom.
Okay, yeah, I can visualize that.
That's pretty much the distinctive shape the left ventricle takes on during an episode. It balloons out at the apex, the bottom part.
Huh. That's a memorable image. And it was first identified in Japan, you said?
That's right. Japanese doctors first described it back in the 1990s. That shape is what gave it the name.
So symptoms are like a heart attack, affects the left ventricle,
Hmm.
but you stress it's different. What's the absolute key difference based on these sources?
The arteries. That's the main thing. In a standard heart attack, there's a blockage in a coronary artery.
Uh-huh.
Blood flow gets cut off, heart muscle gets damaged, often permanently. With Takotsubo, doctors do an angiogram. They look at those arteries, and they're typically clear. No significant blockages causing the problem.
Okay, so if the pipes are clear, what is going on? What makes the heart muscle just stop working properly?
Well, the leading theory, and it's pretty well supported in the material we have, points to a massive, sudden surge of stress hormones.
Like adrenaline, the fight or flight stuff.
Exactly. Catecholamines like adrenaline. The thinking is this huge flood just overwhelms the heart muscle cells.
So overwhelms them. How?
It might cause problems in the tiny blood vessels, the microvasculature, or maybe it's directly toxic to the cells somehow. Either way, the result is this temporary stunning. The ventricle just can't pump effectively for a bit.
And is this something really rare or?
Actually, no, not super rare. The sources estimate it makes up maybe 1 to 2% of all suspected heart attacks.
1 to 2%. That's quite a few people.
It really is.
Yeah.
You're looking at potentially thousands of cases just in the U.S. each year,
Mm.
maybe 6, 7, 8,000. It shows how often it's the body's stress reaction, not clogged arteries, causing these terrifying symptoms.
Which leads right back to that nickname, broken heart syndrome, doesn't it? Because of that link to emotional stress.
Precisely. It's very often triggered by sudden, intense, emotional shocks.
Hmm.
Intense grief, a relationship ending, really bad news.
Yeah.
But, and this is really important, the sources are clear.
Yeah.
Physical stress can absolutely trigger it too. It's not just emotions.
That overlap in symptoms must make diagnosis really tough, especially in an emergency.
Oh, absolutely. It's a major diagnostic challenge. The symptoms hit suddenly: severe chest pain, can't breathe, maybe palpitations, fainting, nausea.
Sounds exactly like a heart attack.
It does. And you absolutely need to get medical help immediately if you feel that, no matter the cause. It's serious.
So someone comes into the ER like that. How do the doctors sort it out? How do they tell it apart from a regular heart attack?
Well, the initial tests in ECG, maybe blood tests for cardiac enzymes, often look identical to a heart attack.
Right. So that doesn't help much initially.
No, and that's where the risk of misdiagnosis creeps in.
The angiogram, looking at the arteries, that's the key then.
That's the critical step, yes. They inject dye, visualize the coronary arteries, and boom, they're clear. No major blockages. That changes everything.
Okay, so arteries are open.
Yeah.
How do they then confirm it's Takotsubo?
Usually with more imaging. An echocardiogram, which is an ultrasound of the heart, or sometimes a cardiac MRI, these scans can show that characteristic ballooning shape of the left ventricle.
That octopus pot shape.
Exactly. That confirms the diagnosis.
It's really striking how easily it could be missed at first. I think one source mentioned a figure for misdiagnosis.
Yeah, there was a 2023 study in JAMALO Cardiology, It suggested that maybe up to 20% of Takotsubo cases might be initially misdiagnosed.
20%. Wow.
Yeah. It really drives home why awareness is so important, especially for doctors.
Let's go back to the triggers. We talked about that flood of stress hormones. Can we flesh out the kinds of things that set it off? It's not just grief, right?
Definitely not just grief. While that broken heart link to emotional events like, bereavement, divorce, getting traumatic news is very real and documented.
Okay.
The sources really emphasize that intense physical stress is just as likely to be the trigger.
What kind of physical stress are we talking about?
Things like a severe infection, sepsis,
Yeah.
during a major surgery, even acute neurological problems like a stroke or a significant seizure.
So like a sudden shock to the system physically.
Exactly. There was a case report mentioned from 2022 about a woman who developed it right after a car accident.
Yeah.
That's a clear example of physical trauma triggering it.
So it's less about what the stressor is, emotional or physical, and more about the sheer intensity of the body's reaction.
That seems to be the common thread, yes. It's the sudden, overwhelming nature of the stress that kicks the system into overdrive, releasing all that adrenaline.
And it feels unpredictable, but are there factors that make someone more susceptible?
Yes, there are definite risk factors.
Who's most at risk here?
The data is incredibly skewed towards women, particularly postmenopausal women, generally over 50.
Really? How skewed?
Hugely. They account for something like 85 to 90% of all diagnosed cases. It's quite dramatic.
Wow, 85 to 90%. Any idea why? Especially postmenopausal women.
The main theory revolves around hormones, specifically the drop in estrogen after menopause. Estrogen seems to offer some protection to the cardiovascular system.
Okay.
And when those levels fall, it might change how the heart and the body's whole stress response system interact, making them more vulnerable to these surges.
Interesting. Are there other risk factors besides gender and age?
Yes, definitely. Having a history of anxiety or depression seems to increase risk.
Why would that be?
Possibly because individuals with these conditions might have a sort of heightened physiological response to stress already. Chronic stress is another one, from work, caregiving, whatever the source.
Makes sense. Anything else, like underlying conditions?
Well, age over 50 is the main demographic, but younger people can get it too. It's just less common. There's maybe a slight hint of family history playing a role, but it's not as strong as with other heart diseases. What's really intriguing, though, is an association with certain neurological issues, like having had a recent seizure or a head injury. That really highlights this complex link between the brain and the heart.
Yeah, that brain-heart connection keeps popping up. Okay, so someone gets diagnosed. What happens next? What's the treatment? And crucially, is the heart okay in the long run? Is it permanent damage?
And here's the generally good news. For most people, the prognosis is actually very positive.
Oh, good.
Unlike a typical heart attack, the weakening is temporary. The heart muscle usually recovers its normal size and function completely,
How quickly does that happen?
often quite fast, within days or weeks, typically. It's not the kind of permanent scarring you see after a blockage cuts off blood flow.
That's a huge difference. So how do they treat it right after it happens?
In the acute phase, it's mostly about supportive care. Stabilizing the patient, supporting the heart while it recovers, preventing complications.
What does that involve? Medications?
Yeah, often medications similar to what's used after a heart attack. Beta blockers, maybe, to ease the heart's workload. ACE inhibitors. Sometimes diuretics if there's fluid building up. In really severe but rare cases, they might need temporary mechanical support, like a balloon pump,
And most people go home pretty quickly.
usually within about a week, yeah.
Okay, so the heart heals physically. But given that stress is the trigger, managing that stress must be absolutely vital moving forward, right? To stop it happening again.
Oh, completely vital.
Yeah.
The physical recovery is one thing, but the underlying vulnerability to stress is still there. So addressing that is key.
How do they do that?
Therapy is often recommended. Things like cognitive behavioral therapy, CBT, or just counseling can help people develop better coping strategies for dealing with major stressors.
So it's really a two-pronged approach. Heal the heart, manage the stress.
Exactly. And lifestyle changes play a big role too.
Yeah.
Learning stress management techniques, meditation, mindfulness, that kind of thing. Regular exercise, once it's safe, eating well. It's a whole picture.
And do we actually know if that stress management part works? Does it reduce the risk of it coming back?
Yes, actually. There's good data on that. A study from 2024, published in the journal Heart, looked at this. It found that patients who went through structured stress reduction programs had about a 30% lower rate of recurrence compared to those who didn't.
30% lower, that's significant.
It really is. It shows that proactively managing stress really can make a difference in preventing another episode.
That's powerful. Now, even though the long-term outlook is good, are there any immediate dangers or complications while the person is actually having the episode?
Yes, there can be. During that acute phase, maybe 10 to 15% of patients might experience complications.
Like what?
Things like temporary but serious heart failure because the ventricle isn't pumping well, or dangerous heart rhythm problems, arrhythmias.
Okay, so it's still serious business at the time.
Absolutely. That's why close monitoring in the hospital during that initial period is so crucial.
And I imagine even after you've recovered physically, the psychological impact must be huge. Suddenly thinking you're dying from a heart attack.
Definitely. The fear, the anxiety around the event itself, maybe worrying about it happening again, that can stick around. So ongoing emotional support is often really important for a full recovery, not just a physical one.
Given everything we've said about how much it looks like a heart attack, raising awareness seems absolutely critical.
It really is. That confusion between the two conditions can lead to delays or mistakes in diagnosis.
Yeah.
So the more people understand it, both the general public and doctors, the better.
Better for getting the right care quickly.
Exactly.
So who needs to be more aware and what kind of awareness helps most?
Well, for the public, it's about knowing that intense stress can cause serious heart attack-like symptoms, and you need to seek help immediately, even if you don't think you fit the typical heart disease profile.
Right, don't ignore chest pain just because you think you're only stressed.
Precisely. And for doctors, especially in the ER or cardiology, it's about keeping Takotsubo in mind. Thinking about it, especially when they see, say, an older woman with chest pain after a big stressful event.
And making sure they do the tests to differentiate, like that angiogram showing clear arteries.
Yes, exactly. Considering it in the differential diagnosis and using the right tools to confirm or rule it out.
Are there places people can go for more information or support?
Yeah, there are resources out there. Support groups are forming. There are community initiatives sometimes. And specific organizations focused on it, like the Broken Heart Syndrome Foundation, are working to promote research and understanding. Sharing patient stories helps a lot too, just making it less mysterious.
Okay, so as we wrap up this deep dive, what's the main thing you think people should take away about Takotsubo cardiomyopathy?
I think the key insight is that broken heart syndrome isn't just a metaphor, it's a real physical condition. It's usually triggered by intense stress, either emotional or physical. It makes the heart muscle temporarily weak, looks just like a heart attack.
But crucially, it's usually temporary and people recover fully.
Right. And it just powerfully demonstrates that connection between our minds, our stress levels, and our physical heart health.
It really challenges that old idea of the mind and body being totally separate, doesn't it?
It absolutely does. It forces us to think about heart health more broadly.
So understanding Takotsubo really shifts how we think about what affects our heart. It's clearly not just cholesterol and blood pressure. Our emotional lives, our stress responses, they have a direct physical impact. It makes you wonder, doesn't it? What does this condition, born from life's hardest moments, really teach us about the hidden power of stress? And maybe how we need to rethink managing it not just for mental peace, but for the actual physical well-being of our hearts. That's something we're thinking about.